Hi everyone, it's Sarah from McLean Dermatology. I'm here to help you decode some of the bumps that might arise on your skin. Very often during skin checks, we see a multitude of different bumps, and it's helpful to know what is there and what can be done about it. On the face, most commonly, we see two types of bumps as the years go by. Some patients might notice on the forehead, along the sides of their face, they get these pesky little raised, kind of yellowy orange bumps that might have a little central indentation to these. These are called sebaceous hyperplasias, which is an overgrowth of the oil gland. We tend to get these when we have naturally oily skin, and they're very genetically driven and also from sun damage. Luckily, we can treat these cosmetically with a little cautery device, but it is good to differentiate, are these skin cancer or are these harmless little pesky bumps? Another bump that we see quite often are little white bumps that almost look like whiteheads that just won't go away. I see these very commonly underneath or around the eyes, on the forehead, but they can happen anywhere on the face. These are called milia, which are kind of like whiteheads that just get stuck. They crystallize and they are there for good. We can easily remove these with extractions. Either one of the providers can take care of them, or they're great to have removed during a facial. Try not to do this at home, as that could lead to scarring or worse, skin infections. Another bump that we do see is sometimes a little red bump on the skin. It might be slightly raised or flat, and often these are cherry angiomas, which are blood vessels. These are harmless, and we can get rid of them quite easily with either a laser or a cautery device. A bump that we see quite commonly on the nose is called a fibrous papule or an angiofibroma. These are harmless skin-colored growths that can be very stubborn to treat. It's good to have this looked at and differentiated to make sure it's not a superficial skin cancer, but just a harmless bump on the nose. Lastly, a common finding that we see on the face is broken blood vessels. If you see almost like a spider web-like appearance to this little red spot, often it's a broken vessel. These happen a lot from overexfoliation or sun damage, and we can easily remove them with the laser. So it's helpful to come in once a year and have your skin checked to make sure these little bumps or growths are harmless, and also talk about, if they bother you, what we can do to remove them, because they very easily can be removed with minimal downtime. So if anything seems new on your skin or worries you, bring it in for us to evaluate.